What if I don't enroll in Medicare Part D with VA benefits? What happens if you choose not to enroll in Medicare Part D while having Veterans Affairs benefits? This is an important question for many retirees. Let's break it down. First, it's essential to understand that Veterans Affairs prescription drug coverage and Medicare Part D are separate programs. They do not work together. If you're relying solely on Veterans Affairs for your medications, you will need to get your prescriptions from Veterans Affairs providers or their mail-order pharmacy. This means you won't have the option to fill prescriptions at local pharmacies under Medicare, which could limit your choices and convenience. Another factor to consider is the potential late enrollment penalty. If you do not enroll in Medicare Part D when you first become eligible and do not have other creditable prescription drug coverage, you may face a penalty. This penalty increases the longer you wait to sign up and is added to your monthly premium for Medicare Part D. However, since Veterans Affairs drug coverage is usually considered creditable, you might not have to worry about this penalty as long as you keep your Veterans Affairs benefits active. It's wise to check your specific situation to be sure. Relying only on Veterans Affairs for your prescriptions can also affect your flexibility in retirement. Veterans Affairs facilities may not be available everywhere, especially if you move or travel. On the other hand, Medicare Part D allows you to fill prescriptions at many retail pharmacies across the country. This can be more convenient if you find yourself away from Veterans Affairs facilities. From a financial perspective, having both Veterans Affairs benefits and Medicare Part D can provide more comprehensive coverage. This combination could help reduce your out-of-pocket costs for medications, especially if you choose to use non-Veterans Affairs providers or pharmacies. However, if your Veterans Affairs benefits fully meet your prescription needs and you do not foresee any changes in your healthcare access, you might decide to wait on enrolling in Part D. In summary, not enrolling in Medicare Part D while having Veterans Affairs benefits means you will depend solely on Veterans Affairs for your prescription drug coverage. This could limit your pharmacy options and convenience. Additionally, you might face a late enrollment penalty if your Veterans Affairs coverage is not deemed creditable or if you lose your Veterans Affairs drug benefits. Evaluating your current and future healthcare needs, access to Veterans Affairs facilities, and potential costs is vital when making this decision as part of your retirement planning.